Today we are actually recording at the Baylor Scott and White Heart Hospital, right?
Mm-hmm.
Is that correct?
Yes.
In the wonderful podcast studios here. So I just wanted to thank you for inviting me up here to chat with you, Dr. DiMaio. I thought we'd just start out with something in our fireside chat that's relevant to Spectral AI. Usually we look at broad healthcare themes in this segment, but there were a number of presentations at the British Burn Association conference in early June, and they addressed some features of DeepView and what AI can do to help improve diagnosis. What are some of the main takeaways that you got from these presentations? From your partners in the development of the device.
The early generation of DeepView is now in the hands of several British burn centers, and so this is the first what we call RWE, or real world evidence, where you really have a device or drug, or in this case a device, in the hands of physicians and patients. So you learn what's going right and what's going wrong, and lots of things are going right. It's easy to use, easy to get images, and easy to triage patients. So what the British doctors have done is they're writing papers, and they were presented at the British Burn Association and other meetings as well, that says DeepView is very easy to use, and preliminary studies show accuracy as high as 94% in predicting whether or not a burn is going to heal or not, which is the whole purpose of DeepView, to be able to say that something's going to heal.
And how did you develop this relationship with the UK? I mean, you've been supported by BARDA in the United States, but you've also got exposure to the UK and Australia as well. How did these relationships develop?
So the company went to the AIM market, which is a London Stock Exchange market. We were on the AIM market, and so with that, we had certain initiatives and obligations to be able to serve the British community, and so the emphasis was to do that. In addition, the hurdles were not as high to get into the British market.
Okay.
And so that's where they are. But to your question about what we gain a lot of information on real-world usage of the DeepView device, and we're utilizing that to an iterative approach to improve the software and hardware on DeepView.
Okay. And you're also in Australia. I think you've got 3 devices there, if I remember correctly. How did that relationship emerge?
Well, as you know, back in history, being a history buff like you are, Britain and Australia have a lot of collaboration in many, many ways, and the medical communities exchange a lot of information back and forth. So the Australian physicians wanted what the British physicians had, and so with that, we put several units there. And there are several companies there in Australia that wanted to see whether or not we could leverage the imaging with the skin substitutes that they are interested in. And that's a different conversation that's going on as well.
Okay. I thought I'd shift into a question about the markets. You just mentioned recently, or just earlier in our conversation, that Spectral has up 3 times over the last year, and you have since submitted your application, which is it's a huge milestone. What do you think of the broader markets and the ease of accessing capital? It's been pretty tough over the last few years. However, I would say in the last months, M&A has picked up, which is usually a positive indicator for interest in the space. Share your thoughts, Dr. DiMaio, on that topic and how Spectral AI fits into it.
Well, since I got active more in the company, I think that the stock price reflects that confidence by the market at large. The market is efficient, as people have many said, and if you say what you mean and mean what you say and do it, then the markets respond to that. So that's why we talked earlier about the 3 Fs: finance, focus, and finish. And we laid that out very clearly. The press releases that we had and everything else said that's what we're going to do. And you can even see when we did submit the FDA submission, then the stock market reacted as well. So the point of all that is to say that I think that even though it's been a difficult year or two, whatever, I know the future is very, very bright, because now we have the application into the FDA. With the support of the FDA, we fully expect that to be cleared in the near future, and then we're ready to go to market. We have the infrastructure we're building, and we have the entire burn community supporting us. Several of the past presidents of the American Burn Association are doctors that are supporting our technology and our research. The entire United States burn community and British burn community as well is very interested in our device.
Okay.
Because there's nothing else like it. There's really nothing else that provides what we provide to the burn victim.
I also thought we could dive into some of the bigger themes in life sciences. AI has been one of the big things, for drug development. You're using it in your diagnostic, and I think the FDA actually said that they may use it for evaluating whether or not to accept
Yes.
accept a submission. What are your thoughts on some of the themes, maybe including AI, maybe some other things that are going on in life sciences right now that have the potential to be big in the future?
That's a good question. Again, being the chief of staff for the Heart Hospital, I see many,
right,
many
yeah.
applications come in front of us with AI, imaging devices, be it radiology, et cetera. There's artificial intelligence algorithms to predict operating room times, efficiencies, who to admit, who not to admit, et cetera. But the big thing I said that I think is important is what I call the ground truth.
Okay.
You can train a lot of algorithms, but if you just train it on itself, that doesn't necessarily make you smarter. You need to train it on the best possible answer or solution. So in the instance of DeepView, we're looking at burns and 21-day healing, but we have these burn experts and the skin biopsies to train the algorithm. That's the best ground truth you could possibly have. And then we train the algorithm. So what I'm saying is that whether it's a new device or new AI algorithm being trained for an echo or an x-ray or whatever, it needs to be trained on the best ground truth.
Okay, so yeah, it sounds like ground truth is applicable to anything where you can gather data and then look later to see how it turns out,
Right.
and then find out what attributes were related to that improvement or not related to it, and then make your prediction. So,
Well, as you know with AI, because you've done a lot of research, it's a training and validation cohort. So you may take 3/4 or 2/3 of your data to train an algorithm, and whatever it's going to be trained in, then you take 1/4 of the data for the validation of the data.
okay, right. Then you
So
test your
then you
hypothesis,
test your
right?
hypothesis that whatever you're trying to train it to do, it can do it. And that's an important thing for anybody to understand about AI. It doesn't just happen magically. You want to train your algorithm with a certain hypothesis, like you just said, and then take another set of data that's naive to the algorithm and see that it performs the way you thought it would perform.
Right. Successful new products in the healthcare space usually save money and they address some unmet, some stark unmet need. What are some leading technologies that you see out there, besides DeepView, of course, because that's shown that it is successful, but besides DeepView, that are able to achieve that?
Well, let's talk about the imaging space, because DeepView's in the imaging space.
Yeah.
And so as a cardiovascular physician, the imaging space includes cardiac echoes,
Okay.
includes CT scans, MR scans. Those are all imaging. It involves pixels and images and all that. So I could see mammograms are a great example. Lots of research, lots of companies pursuing mammogram to use AI, not to replace.
How widely, actually, I'm wondering, how widely is AI used right now in mammograms, MRIs, CT scans? How often is it used? I feel like it's not used very much. It's mostly in the research stage. Is that true? You're the practitioner, so you have a good hold on this.
So you're right. I would not say it's used widely, period. And I think that actually there was one of the godfathers of AI predicted some time ago that the radiologist would be not
obsolete
needed
or something.
Obsolete,
Yeah.
and I won't quote that, but if you can look it up, and that proved to be wrong.
Yeah.
There's many things that the human mind can do, the human eye and the experience that AI has yet to achieve. So I emphasize, just like DeepView, that these are decision assists.
Yeah.
So they may be able to help further identify a lung nodule for a CT scan, or a potentially cancerous mass in someone's breast for the mammogram. But again, the final decision is going to be up to a physician, and that's a key thing I think people should remember.
Yeah, I was reading through some research that was done. It looked at radiologists, and it found that the best result was a radiologist combined with AI. I think it was for oncology indication or something like that. But yeah, it's definitely a help, right? Because the human eye sees certain things, and AI sees everything, but may get confused, right? So the combination of the two helps kind of filter out the bad stuff.
We talk about hallucination with AI, right? That's the key word people talk about, that the AI algorithm gets lost in whatever it's trying to sort out or look at, and a human could as well if they're not paying attention. But you have a check and balance with a human. They get a cup of coffee and get freshened up or whatever.
Yeah, exactly. Well, and then also, the one thing we have to say is that AI is trained on human output, right? So it's like it couldn't stand by itself. It relies on the human input to do what it does. Another important factor about DeepView that I think is really important for people to know is that I think standard of care requires a wait from when the patient comes in for burn diagnosis. They want to see kind of how the wound goes for the first certain period of time. What is that?
Yeah, wait and see, right?
And how long is that?
Yeah, it's 1 to 3 days.
So
as long as
that's
5.
a long time when you're burned and in a serious condition. Because I mean, I've always understood in anything, faster treatment is better. You know,
Yes.
if you know what you got to do,
Yes.
do it right away and
Yes.
address it before it gets worse. So it sounds like the standard of care has this huge fault in it. I don't want to offend anybody, but
Yeah.
I mean, when I heard that, I was kind of incredulous because I would think it would be. But DeepView actually addresses that, doesn't it?
Absolutely.
Yeah.
Absolutely. I mean, the whole key, like I say, triage and treat, is to triage get the patient with a serious burn injury with a large body surface area to a burn center as quickly as possible. And then in the burn center to treat, it'll tell that there's a significant burn area that's not going to heal. The sooner you know that, you can go to the operating room and take care of that.
Yeah.
And your point
Yeah.
right now, in many burn centers, no criticism of burn doctors, but many have to watch and wait and see what progresses. And there's something else, which is another topic, it's called burn wound progression, whether or not it changes over time, but that's beyond the scope of this fireside chat. But your point is very well made, is that right now doctors will look, see, day 1, day 2, day 3, and determine, boy, this is not healing.
Yeah.
Let's go to the operating room.
Yeah.
And the sooner you have that decision, or the assist of that decision, the better.
Yeah. I mean, I see that as a huge unmet need that,
Yeah.
that's addressed. I thought we'd talk about the regulatory side of things a little bit. There's been a lot of changes at the FDA in the last months, including a turn towards using AI for regulatory submissions, and then a lot of other stuff too. What's your take on the direction the FDA is taking? Actually, another thing that came out is they released a lot of the complete response letter responses. And for those of the viewers that don't know, complete response letters are what the FDA sends a company when it fails to get its drug approved. And a lot of times we don't know kind of what the FDA said, which makes it hard to know what, in a large sense, might need to be improved. So that was another thing I thought that was pretty interesting that was out there. But I just thought I'd throw that your direction. And there's probably other news too that you can comment on how the FDA is changing and what it means for the future.
Well, for our particular project, and we've been talking to the FDA for a long time, different iterations, different phases of the device, they've been very supportive. I must say we have worked hand in hand, arm in arm with them, and it's evolved, as you said, with AI. When we started the company and started the process, it was not for AI. We just had the multispectral imaging. So we added AI. That's a whole nother level of complexity for us and for the FDA. So working with our data scientists and the data science experts at the FDA has been a very interesting iterative process. And I've been very happy. They have listened to us and we have listened to them to work together. This has not been a one-sided conversation. It has been a two-sided conversation, which is what you need with new technology, new pathways, and the FDA recognizes that and has been responsive to that, which has been very rewarding.
Okay. Well, actually, you brought up something interesting I thought I'd ask about, is just how you decided to add AI to the mix. Because you said, initially DeepView was only using multispectral analysis, so you get a picture probably with colors on it or something. But you decided to add a layer AI on top of that. How did that come about?
Yeah, that came about. Some of our scientists as well realized that we'd reached a certain plateau or level of information.
What a human was able to.
What a human is able to do, and so there's a picture, red, green, blue, whatever.
Yeah.
Okay. Now what does that mean?
Yeah.
So as I said earlier, several things happened in technology. The cost of chips went down. The cost of storage went down, and processing speed improved. Transmitting information, that all led to computers, information, and more interest in, hey, can we apply these algorithms to data? In this case, our data is pixels that we're analyzing, and with those pixels, we're creating a binary output that something heals or doesn't heal. So now by taking images of burns and truthing them, as we said before with the ground truth, we can apply an artificial intelligence algorithm using all kinds of techniques, convolutional neural networks, and all kinds of other methodology that we use in our AI algorithms to be able to create an output that says something's going to heal or not heal. So in summary, what we're saying is that we realized we reached a plateau with multispectral imaging, but now we can use that to yield a predictive output of healing or non-healing. And that can only be done with an algorithm.
Yeah, yeah. And it's a lot faster, too, than trying to have humans do it.
Mm-hmm.
You know, I thought I'd end on a note just talking about a really broad theme is kind of China's place in the healthcare universe. You know, most of my time is spent on drugs, and some of my time is spent on devices.
Mm-hmm.
How do you think China will evolve over the next years to, you know, potentially take up a larger space in medical technology? You know, they're I guess there's the AI war going on between the U.S. and China right now. What are your thoughts on how that might change over the next years?
You're getting to political.
Well, I mean, we don't have to get into the political side of things. Just, I guess, in terms of the growth of the technology, the spread of the technology. Yeah. I mean, I think they had this 5-year plan that was like in 2016, where they're going to allocate 4%. I may be wrong on that number, but of GDP towards. Yeah. I think it was life sciences or something like that. Yeah. You know, so they're throwing a lot of money at it. So even if their success rate is lower than we have here, if they throw enough money at it, they're going to have some successes, right?
Well, I'm not sure if this applies or not, but look at the auto industry. What they've done, BYD.
Right. Oh, I mean, it's amazing.
If they, you know, 1.3 billion people.
Yeah.
And the federal government, which is more of a monolithic type environment, applies the influence, pressure, resources to a problem, it can move the needle pretty significantly. I mean, right now, the electric vehicle market in China is clearly
superior to anywhere else.
Superior to anywhere else.
Yeah.
However, what I would say, and I actually taught in China some years ago.
Okay, so you have a good perspective on that.
And I have some perspective. The ingenuity, imagination, and motivation in America is second to none. So, you know, my little company, what we have done, I think, is really leapfrogged over anything else that anybody else I've seen with imaging. And we've been thoughtful, truthful, hardworking, and focused to yield DeepView. And I'm very, very proud of that. So back to your question, I think that having a physician, a cardiothoracic surgeon, driving a company that has an interest in solving a medical problem, I keep it real and I keep it true because I know what we need to have at the end of the day. And we have all the support of the burn doctors and the whole medical community, which is what we're trying to do.
Okay. Do you see DeepView expanding into China at some point?
I do.
Okay.
I do.
All right. Well, with that, we will end our discussion today. And Dr. DiMaio, thank you so much for joining me here. It was a great conversation. We kind of went all over the place. Automobiles, FDA, everything.